What's up, everyone? It's me, Drew Manning from Fit to Fat to Fit, and I'm here with Dr. C at Utah Stem Cells. And I want to introduce Dr. C really quick. So the reason I'm here today is because I'm a big fan of preventative maintenance, and so that's why I'm a big fan of stress management, exercise, sleep, supplementation, nutrition to prevent disease from happening, prevent aging. And Dr. C is a specialist at this as well. And I'm also a big believer in it for sexual performance. So today I am here at Utah Stem Cells with Dr. C. He's going to be performing a PRP and stem cell shot, which is called the PShot.
Yes.
Now, why don't you explain to my audience? They might have heard what PRP is, right? Because I've explained about PRP in the past. Talk about why stem cells and what you guys do specifically.
Sure. Well, these procedures were first invented by a physician called Dr. Runnels, and that's who I was trained with. And if you're doing the PShot and calling it the PShot, you really have to have been trained by him and follow his methodology. And we do a lot of continuing medical education and sharing of information. And that helps people know that if you're getting the PShot done and they're using the PShot trademark name, that you're getting some consistency, that you know that the provider knows what he's doing. Let's put it that way. So the treatment initially was done just with PRP, platelet-rich plasma.
Okay.
And a lot of what we learned about how we can use stem cells to treat other parts of the body, like joint problems, like orthopedic injuries, things like arthritis, ligament tears, tendonitis. All of those treatments that we now do with stem cells and PRP, initially were all done with PRP alone.
Gotcha.
The PShot was initially done with PRP alone. The same doctor who invented how to do the PShot coined the term vampire procedures. And he taught me how to do hair restoration, for example. We can do breast lift, medical aesthetics, a lot of different things. But it all started from the science and from the evolution of the science of starting with PRP alone.
Gotcha.
So a lot of what we know about how PRP and stem cells work together, we've learned from the orthopedic industry or orthopedic arena, because that's the longest running application of stem cells. We're learning every day, doctors are learning different applications of stem cells. We can use it now to restore vision, hearing, heart failure, lots of different things. But it all started with PRP to treat knees and joint problems.
Gotcha.
So initially when we use PRP alone, usually it takes several treatments for most things. Okay? I'm going to give you the example. Again, I'm going back to the musculoskeletal arena and my experiences and other doctors' experiences with musculoskeletal conditions.
Okay.
When we would treat, let's say, a really bad knee arthritis, it usually was about 3 to 5 treatments, maybe 7 treatments of PRP. It was very rarely one treatment and you're done. Okay? When we do PRP treatments alone, really what we're doing is we're stimulating your body to send its own stem cells to come to the area where we just treated with PRP, and those stem cells are what's going to turn into your new healthy tissue and create new blood flow, blood supply to the penis, for example, when we're doing the PShot. And so knowing what we know about the orthopedic, in the orthopedic field, it usually took, again, 3 to 5 treatments when we did PRP alone, but ultimately people did get very, very good results. Once we learned we could add stem cells to the PRP, there were some big advantages to that. And here's why. Again, when we do PRP alone, we're relying on your body to send its own stem cells to try to repair the injury we just caused. PRP is a little bit caustic and could cause some irritation to the native cells, tissue that's in that area. And so your body considers that an insult, like there's been damage. Even though it's not damage, these are therapeutic cells, right? But your body thinks of it as something bad's going on, there's been some trauma. So then that stimulates your body to send stem cells. So when we do the PRP injections alone, we're relying on your own body's stem cells to come there and turn into new healthy tissue.
Gotcha.
When we add stem cells directly to an area like the genitalia, then we're not relying on your body's aged adult stem cells. You're in phenomenal shape, you take good care of your nutrition, all that's very important. That helps the stem cells do a better job or achieve their goal better. But despite that, you still have older age stem cells. Remind me again how old you are.
38.
38, all right. So that's the new 28 or 25, I guess. You got a long way to go. I'm 53 now, so I'm gonna be 53 in two more weeks. So I better hold on to 52 for as long as I can. But the reality is, your stem cells are still 38-year-old stem cells, right? My stem cells are 53-year-old stem cells. What's better than 53-year-old stem cells are 0-year-old stem cells. So we take the stem cells from a live, healthy birth. A mother is going to be scheduled for C-section, and she's asked if she wants to donate her placenta or umbilical cord so that people can use it to treat other parts of the body. It's all charity, it's all donated, and these are very close in nature to embryonic stem cells, which are not legal in the United States. Embryonic stem cells come from aborted fetuses, and because of the ethical concerns of where they're derived, they're just not legal here because of the ethical concerns. But there's no ethical concerns with the stem cells we use because these people are going on to have a live, healthy birth. But these stem cells are much more immature, potent, have similar characteristics to the embryonic stem cells. And so there's no real need to go fly to other countries. Why are people going to other countries to get stem cell treatments? Well, a lot of times it's because they're using embryonic stem cells in other countries where it is legal. Here in the United States, we use umbilical or placental stem cells, base stem cells, and growth and healing factors, and those are all perfectly legal. And so knowing what we know about the orthopedic field, we can say that, and this is what our experiences have been also, is that you get better results. If you might have needed 2 or 3 treatments to get excellent results, now you're going to get it with one because we're depositing thousands of times the stem cells, much more than what your body will send in, and they're much younger, more potent than your adult stem cells.
Gotcha. So one of the biggest questions I have, because I think I understand what you were talking about, the PRP with the stem cells. So in the past, I've had the PRP shot before, and you know, it's a sensitive area. It really is, and it was painful. It was painful.
Right,
so you guys,
right.
I want you to give you a chance to talk about what you guys do to help prevent the pain.
Sure.
Because it's a sensitive area, and I went through the pain of I had numbing cream, and then the shots came in, and I was sweating.
So PRP can be so PRP is actually the more painful part of the stem cells. Stem cells can be a little painful too. But we take the PRP from you, we do a blood draw, as you know. We spin it down through a special centrifuge process, get the platelet-rich plasma. The PRP has a lot of growth and healing factors that helps the stem cells turn into what they're doing. Plus, it'll help attract your own stem cells to join the fight also. But it's a little bit painful, and I've treated multiple parts of my body, okay?
Yeah.
I've had orthopedic injuries. I got into this field because I had really bad arthritis in my knees. I was an ER doctor and a toxicologist for many years before I started doing interventional orthopedics and before I became a stem cell regenerative specialist. And that's quite painful. Now, PRP. But it's brief, like you said, but there are things that we can do to get rid of that pain. And some places don't do it. And I'm always shocked when someone's had a procedure done at another facility and they didn't do any anesthetic blocks or numbing medicine, or they didn't offer nitrous and things like that. Because I can tell you, it would be too painful for me to do. Let me give you another example, like when I treat hair, because we can regenerate the hair follicle, and I've done that procedure. That the first time I did it without nitrous. And it turns out the scalp is a really sensitive area.
I've done that too.
And I've had patients who have had the PRP treatments for the scalp, for the hair, and they also, those facilities aren't numbing it properly. So if you're trained in the proper technique, you will numb, for example, the scalp here and in the back. You hit the nerves that feed the scalp so it becomes numb. But then despite that, sometimes a little pain will get through, and then the nitrous is very helpful. When we do the PShot, really we do a penile block. Again, the numbing medicine doesn't go into the penis. That's one nice thing. It's in the pubic area near the base of the penis, not on the penis. So it doesn't really hurt much to numb it up. And that should deaden the whole penis, so you're not feeling pain. Otherwise, it would be a little bit painful, to be perfectly honest. So if you're thinking about doing this procedure, make sure that they're doing a penile block properly and using lidocaine to numb the nerves of the penis, because it is a little bit uncomfortable.
Gotcha, that makes sense. Well, I'm really excited and anxious, a little bit nervous, but I know it's kind of like, you know, working out. It can be hard, it sucks during, but afterwards the results is what you do it for, right? So I know that what I'm doing this for, and I'll be really excited to report back to you guys on the changes, the differences that I notice to educate you guys on these types of procedures, because they are becoming a lot more common. And so grateful for you, Dr. C,
Thank
for
you. Thank you
doing
for
this,
having me.
and I'll let you guys know how it goes.